Most of us have, on occasion, had too much to drink, taken painkillers, and may even have experimented with drugs. For some people, these experiences with drugs and alcohol will lead to a substance use disorder. Once a substance use disorder takes hold, the person may not realize that their misuse of alcohol and drugs is destroying their relationships at home and work. In this program, we'll take a look at how people can develop substance use disorders and the effects that drug and alcohol use can have in the workplace, as well as learn how to prevent and treat substance use disorders. The term substance use disorder is defined as an overuse of alcohol, a misuse of over-the-counter medications and prescription drugs, or the use of illegal drugs. It can also involve inhaling or huffing chemicals such as solvents, lighter fluid, and glue to get high. Substances that produce a high affect how the central nervous system functions. Depressants such as alcohol and sleep and sedation drugs like Ambien slow down brain activity. Stimulants including cocaine, amphetamine, and methamphetamine increase heart rate, blood pressure, and respiration. Other substances that can create a high include opioids such as heroin, morphine, fentanyl, methadone, and oxycodone. Psychedelics such as LSD and magic mushrooms, and marijuana. Like marijuana, there are also other drugs that can affect people in multiple ways. Ecstasy, for instance, is both a stimulant and a psychedelic. A person's personality and ability to function if they have a substance use disorder is directly affected by the drugs that they take. Cocaine or other stimulants can make people overconfident, hyperactive, and even reckless, which significantly increases the risk of them having an accident on the job. Alcohol, the sleep aid Ambien, and other depressants create a dangerous sedating effect that can slow a person's reaction time and prevent them from thinking clearly. And since people frequently feel good when they are using alcohol and drugs, they often don't recognize that they are actually dangerous to themselves and others. Additionally, the residual effect of a substance can cause a person to have an accident hours or even days after they last used it. So what someone with a substance use disorder does on their own time can still affect them and their coworkers on the job. Marijuana or cannabis is still classified as an illegal drug under federal law, but since it is widely used for medical purposes and is legal for recreational use in many states, it has become more commonplace and accepted. Also known as weed or pot, marijuana does have beneficial uses. It can be used to ease chronic pain, control nausea and vomiting for chemotherapy patients, and restore a sick person's appetite. Some studies say it can also help with seizures. But while it can be beneficial, marijuana also comes with risks that can affect a person's health and life. Since it is a drug that affects people differently, marijuana is classified as a depressant, stimulant, and a psychedelic. Like alcohol, marijuana can impair short-term memory, reduce the ability to concentrate, affect coordination, and slow reaction time. all of which increase the risk of accidents and injuries in the workplace. As you would expect, as marijuana has become more widely accepted, more and more people are using it. But today's marijuana is stronger than ever before, and people can become addicted to it much more easily. In fact, the federal government says that 1 in 10 people who use weed will become habitual users. Alcohol is by far the most commonly misused of all drugs. In the United States alone, there are over 60 million binge drinkers. More than 40% of workplace accidents are caused by people drinking on the job. And more than 13,000 people die each year in automobile accidents involving alcohol impairment. Impairment starts with the first drink, making it extremely dangerous to have even a quick nip and operate vehicles or machinery. So if a coworker who appears to be impaired is attempting to drive or use heavy equipment, notify your supervisor immediately. If you aren't on the job, call the police. But be careful when approaching a person who is impaired by alcohol or drugs. They may not act rationally and might even become violent. You also need to be prepared to get medical help for a coworker who has overdosed. The most commonly overlooked depressants on a job site are fumes from paint, aerosol cans, glue, gasoline, and similar products. Breathing in or huffing these inhalants not only affects your brain, but can permanently damage your lungs and respiratory system as well. According to the National Institute on Drug Abuse, more than 75% of drug overdose deaths involve an opioid, drugs like heroin and oxycodone. In fact, opioid-involved deaths have been increasing significantly in recent years, which is largely attributed to the appearance of the powerful opioid fentanyl in the illegal drug trade. Fortunately, thanks to the drug naloxone, an opioid overdose doesn't always have to result in death. Naloxone can rapidly reverse an opioid overdose and is now a medication approved by the Food and Drug Administration. While they are not used as frequently, illegal stimulants such as cocaine, methamphetamines, and crystal meth are all extremely addictive drugs as well, with terrible side effects. For example, someone who uses crystal meth can have a tremendous amount of energy, but they lose the ability to think rationally and act safely. And since crystal meth is made from highly toxic and corrosive materials, users can also lose their teeth from smoking it. On the other hand, people who use opioids experience persistent drowsiness and fuzzy thinking. So on a job site where everyone needs to be alert, users of stimulants or depressants can put themselves and others at serious risk. While people often focus on drugs like opioids and illegal substances when talking about substance use disorders, all drugs have the potential to be misused, including prescription and over-the-counter medications. Many people assume that these drugs are safe because they are legally available. But over-the-counter and prescribed drugs can also become addictive and result in a substance use disorder as well. Prescription drugs that have the greatest potential for misuse include stimulants such as the amphetamine Adderall, and opioids such as oxycodone and medications containing codeine. Over-the-counter drugs that can cause problems include cough syrup containing dextromethorphan, DXM, which can be used to get high, and allergy medications whose misuse can cause drowsiness, blurred vision, and increased heart rate. One thing that is common to many people with substance use disorders is that their use escalates over time. Someone who misuses substances can eventually build up a tolerance to them, so that they need to keep using more and more of them to get the same effect. While this tolerance may make the person feel that they're in control of their substance use, it's actually a warning sign that they're becoming dependent on their drugs or alcohol. Psychological dependence comes first. This is when someone can't help wanting a substance, so it increasingly becomes the focus of their lives. Eventually, physical dependence will occur as the person's body also becomes dependent on the substance. At this point, if the user doesn't get their daily dose, they begin to feel physical symptoms of drug withdrawal. Misusing any substance can lead to psychological dependence. Physical dependence usually results from using cocaine, heroin, opioids, or alcohol. People who have developed a dependency often can't or won't see what is obvious to the people around them. This is called denial. So if anyone expresses concern about your drug or alcohol use, listen to them. Because if you were really in control, they probably wouldn't be talking to you about it. As you've probably guessed, substance use disorders don't play favorites. When the circumstances are right, anyone of any age can develop a substance use disorder. To stop that from happening to us, we all need to monitor our behavior and be honest with ourselves. To prevent developing a substance use disorder, never use illegal drugs. Don't self-medicate. Remember that just because a drug might be legal, that doesn't mean it's safe. Only take prescription medicines that have been prescribed by a reputable doctor. Follow the directions for all of the medications that you use. And if you drink, don't overdo it. Dependency on alcohol and drugs is a disease, and as with many illnesses, a person's heredity can play a part. If there is a history of substance use disorders in your family, you need to be especially careful. There are no known cures for drug or alcohol use disorders. With treatment, a person can recover, but they need support to prevent a relapse. Keeping substance use off the job site should be a top priority for all companies, which is why so many of them have formal drug and alcohol policies. Your company's policy can help to keep you and your coworkers safe by providing simple guidelines for everyone to follow. Employees are expected to be completely drug and alcohol-free when they report for work, and must remain that way throughout their workday. Everyone should also adhere to the company's drug and alcohol policy when they are representing the company at social gatherings, attending company-sponsored recreational and other events, or are on call or awaiting assignment. In addition to listing behaviors to avoid, your company's drug and alcohol policy will outline the steps that you should take if you are struggling with a substance use disorder. It will also contain information on what you should do if you suspect that a coworker may be using drugs or alcohol. Remember, keeping quiet about substance use in your workplace is dangerous. Unless someone with a substance use disorder is reported, they'll never receive the help that they need, and will continue to be a threat to the health and safety of everyone at your company. When an employee with a substance use disorder is reported to management, the company will investigate the situation. Anyone who is suspected of being impaired on the job will immediately be removed from any tasks that could endanger themselves or others. They will then be interviewed by someone who is trained to handle substance use disorders. When they are confronted, some people with substance use disorders immediately ask for help. But if a suspected user denies that they are impaired, a reasonable suspicion alcohol or drug test can be given. Urinalysis is a common form of pre-employment and random drug and alcohol testing. Employee oral fluids testing is also approved for use by the Department of Transportation, DOT, and for all federal employees and companies with federal contracts. Oral fluid testing offers a variety of advantages for employees and employers alike. The tests take less time, are less likely to be tampered with, and eliminate the need for private restrooms and same-gender collection arrangements. A company can also perform periodic alcohol and drug tests to uncover substance use that might otherwise go unnoticed. Government regulations require random substance use tests for truck drivers, pilots, and other transportation industry employees who have safety-sensitive jobs. Failing a substance use test will not necessarily result in disciplinary action. However, the employee will be required to enter a drug or alcohol rehabilitation program. It's important to note that OSHA does not allow a company to conduct drug tests on employees as a form of retaliation when the worker has complained about unsafe work conditions. OSHA has also stated that employers' policies should limit post-incident testing to situations in which employee substance use is likely to have contributed to the incident and can only be used when the test could accurately identify the impairment caused by drug use. When an employee has a drug or alcohol substance use disorder, the situation will typically be handled like any other serious illness. A leave of absence can often be arranged, or in some cases the employee can be assigned alternate work while they are recovering. Remember, your company's objective is to get rid of substance use disorders, not employees. In most cases, only people who refuse treatment or have caused a serious accident will face suspension or termination. Some companies have employee assistance programs, EAPs, that offer resources to help workers recover from substance use disorders. You can help a coworker overcome a substance use disorder as well by understanding and encouraging their rehabilitation efforts. People who are trying to recover from drug or alcohol substance use disorders need as much support as they can get from family, friends, and coworkers. It's also crucial for them to seek help from people who have been down the road of a substance use disorder and found another path to follow. That's why support groups like Alcoholics Anonymous and Narcotics Anonymous are so important. Cognitive behavioral therapy coaching, and the opioid treatment method, Medications for Opioid Use Disorder, MOUD, which combines FDA-approved medications with counseling, can also help. As we've seen, substance use disorders are a workplace hazard that no one can afford to overlook. And there are things we can all do to help eliminate it. Let's review. Never underestimate the dangers of drugs and alcohol. Know your company's drug and alcohol use policies and follow them. If you think you may have a substance use disorder, talk to your supervisor and ask for help. Inform your supervisor immediately if you suspect a coworker is impaired by drugs or alcohol. If you drink, do it in moderation and don't drive. Use proper respiratory protection when working with inhalants. Never use illegal drugs, and remember that even legal drugs can be dangerous. And follow the directions for all of the medications that you take. By doing your part to ensure that you and your coworkers are drug and alcohol free, you can help to create a safer and more productive workplace for everyone.